So
Right. Are you hearing me?
perfectly.
Fine. Well, thank you very much, Georgie, and I'll go straight into the topic. Great to be with you all. I missed several meetings. Very busy down here in Guyana, but must make time for Mark, who's very special to me. And Georgia, thank you for that wonderful introduction. Just missed out one thing, which was that I also have trained a wonderful doctor who is a vascular at Ross University. And he's doing amazingly well in internal medicine, making us all very proud. And he's, I think, in Washington State. So I want today to talk about a pandemic that's affecting the world. That's not the COVID pandemic, which we all know about. That's very visible, but this pandemic is the invisible one. And sadly, it only becomes visible when persons commit suicide, because suicide is a fallout, a terrible fallout of severe depression and grief. So today we want to just quickly review what stigma is all about and why is that stigma the reason for people not reaching out for help. Why is it that that stigma that attaches to mental health disorders is preventing persons from coming out for help, and they suffer in silence? And then we'll quickly look at some of the methods and discuss, give you time to ask questions. So we'll go quickly through what we are talking about. Is the stigma, and there are some references here. So mental health, it's very interesting, the word mental health. I'll come back to it a little bit, because the word mental health, is, as I always talk about, in itself carries a negative connotation. The word mental to many people seems to be negative. If we call somebody mental, it's almost like a derogatory way. You're a mental case, you know, rather than if we talk about what it's really all about. As you can see here, good mental health is actually good thinking, good emotions, good behavior, being able to control our impulses, and having a balanced personality, which is something we sometimes can't tell ourselves because we all think we're very balanced. But so we think that's positive about ourselves because we push aside the negatives. We don't want to own up to them. But anyway, that's a different story. That's personality traits that we all carry. So good mental health is actually not separate from physical health. And the WHO defines good health as good mental health and good physical health and good social well-being and spiritual health and so on. But in actual fact, I think that should change, because mental health is also physical health, as you will see in a little bit. Mental health is no different from physical health, and it involves good brain health. So we, as you can see from here, is anybody immune from developing a mental health problem? And the answer is no, because we all actually will suffer with some type of grief when we lose a person we love, but not in a way, it's an emotional reaction that's not nice, but it tells us that we all are vulnerable to emotional reactions. So where does this stigma come from? And I just wanted to quickly go through what stigma is. It covers these type of things, stereotyping, labeling, degrading persons, prejudice, and discrimination. And the reference is here for anybody who wants to look it up. It's quite a historical reference from 1963, but so important. Stereotyping is when we just sort of have a mindset that people who have mental illnesses are dangerous persons based on preconceived ideas. They're irresponsible, they can't make decisions, they are childlike and need to be protected. We actually have a court case coming up where a family is taking guardianship illegally over a girl who has a bipolar disorder, and you can't do that. I mean, God, you know, what is going on? So people who have mental illnesses should just get over it. I have a patient in treatment who tells me that her fiance in the States says, "Oh, don't tell me you're depressed, just shake it off, you know, just get out of it." So it's not that. It's really hard when your brain emotions and your chemicals are out of control. So labeling is when we label people with terms and dismissive terms, derogatory terms. And it's sometimes a way to justify why we don't show the interest that we should show. Derogatory words are many, as you know, calling people nuts and crazy and wacko, morally bad, that they should be locked away in an asylum. And this thing kind of really hurts the people who have the mental health problems. And, I'll just tell you a quick story. I had a patient who came to me privately because they went to the public hospital. And she's the lady who was the manager of the bank, and she had a severe depression. She said, as soon as she turned up at the gate, they said, where are you going? She said, to the psych clinic. And they just shouted, oh, this one is for the mad treatment place. That was very, very hurtful. That was persons at the gate who should be, the most welcoming and supportive. So prejudice is where people have preconceived thoughts and ideas based on cultural belief system. And Goffman again describes that very well. Some other papers are out talking about stigma. Quick story here of a true incident where a middle-aged man went over the traffic lights, and when he was pulled out of the vehicle by the officers, they smelled a strange odor. They assumed he was drunk, and he was a little bit belligerent and aggressive. They thought he had drunk alcohol, and they decided to control him by tasering him, and subsequently just died. And when the autopsy was done, it was found that he was actually in a diabetic ketoacidotic coma, where pre-coma state, where the smell was the ketones on his breath. So it's just a preconceived thing that because he was aggressive and abusive, he had to have some kind of mental problem or he was going to harm them. So really not taking the time to assess the situation very well. Preconceived thinking is really negative. So these are things that are affecting people, leading to people with anxiety and depression to becoming invisible. Now, the reality is actually those people who have behavioral problems that are so bizarre or what we call psychotic are just 1% of all mental health disorders. Mental health disorders are over 500 something disorders, including anxiety and depression. But depressions and anxieties are so much more prevalent. We're talking about 20, 30% of the population with depression and 30, 40% with anxiety, especially now young people who are stressed about the future and finances and so on. People who are ill, people who have fears of COVID. There's so many of these emotional disorders out there that people are afraid to come out because they don't want to be attached to that negative label of seeing a psychiatrist or seeking help for that mental health problem. So as I said, the term itself can have a negative connotation because it's, if I ask my medical students, what do you understand by the term mental, I get about 10 different definitions because it's a vague term. It doesn't truly make sense when you analyze it. It comes from either two places, mentum, which is a chin, so it doesn't make sense when you talk about chin health, or mentalis, which is about the mind, which is also very vague. If you're talking about something's vague, young people are not able to connect to that. Well, what are you talking about, this mind? Where is it? What is it about? Is it a good mind, a bad mind? But it's all about emotional, cognitive, and behavioral disorders which arise from the brain. It's a brain problem, it's brain health, and every human being has an emotional center in the brain. We have a cognitive center in our frontal lobe, which can go bad as we age or if people abuse drugs. So depression itself is one of the most painful pain, and when I say pain, the person with depression knows the pain. They know how it is. The pain causes them to cry. The pain is internal. They tell me it feels like a huge hole inside my stomach. And we got to know that depression is not just arising from, say, genetic causes or within the family. It also can be because of some underlying medical condition like a thyroid problem. So it's not fair to have these people stigmatized. As I said, the psychotic disorders are very few, and they also are genetic. And these people should not be blamed. It's like blaming somebody for a brain tumor or for carrying seizure disorders, which are also very, very much genetic. So these psychotic disorders are mostly genetically related. And they're very, very easy to treat with medications. They're controlled, whereas the anxiety and depressions, they're a bit harder because people first have to come to terms that they have it. Many people come with depressions and they don't even recognize that they're depressed. They say, well, I just feel so tired. I can't function. I can't work. So these are brain disorders. All these behavior, emotional, impulse control, addictive disorders are disorders of the brain. And that is where we have to start to recognize the problem. That the stigma is coming from a source that is unreal. It's a lack of education. And we must, as a people, educate our young people to not have this negative mindset that these persons are affected by evil or demon possession. And in Guyana here, it's so negative. It's almost a belief system about possession states and evil and demons very high. So many a times a person with a psychological disorder is taken to the priest, which is fine, but the good ones recognize that, look, this is an emotional situation. Or to take them to even what they call the witch doctors, which is really bad because they do many bizarre things, and they can prolong and cause the condition to progress negatively. So we must look for the bad behavior behind people and then look for what other factors are promoted. And unfortunately, the media itself promotes negativity about people with behavioral disorders and creates a sense of fear, as you can see here from the horrors of Hannibal. And then we had this gentleman, as you know, was involved with the Batman murders. So he had a psychotic problem. Sadly, was not treated and was staying in his apartment plotting that terrible crime of killing people in the Batman movie. So this was a question I always ask, which one of these you think has the mental problem? Many people choose this young man because he's staring, and this one here that's staring and he's smiling. But they all are actually terrorists. They are all school shooters. So it just shows you that appearance are not the way to pick up on somebody having a major problem. So here is a WHO report showing that mental health disorders actually is a leading disability now worldwide. So it's significant. Secondly, with alcohol and so on. But there are so many of our young people, 21% of our youth with a mental health problem, with the problem started in the young, and the disability cost is huge, $23 billion. Because of absenteeism and not being able to function well. So that is a huge problem. So here we go into what can we do? We want to change. We want to stamp out this stigma. It's a time for us to stamp it out, to make it go away by working together. There are many organizations that are working towards destigmatization. In 2009, actually, there was a task force to destigmatize psychiatry. The whole field of psychiatry is being stigmatized negatively itself, and psychiatrists. So what about the patients? So there is hope. And I look to Rotary as a future hope for us. You all are doing superb work for Guyana already. And there is much that Rotary can do as All Nations Club, as international clubs connected, to be able to take away this negativity attached to mental health problems. So thank you very much for having me, and we have a little time. Mark, was I on time?